Hey everybody, it's Laurel Fake with Niche Med coming in today with a topic about lifestyle medicine. So, as I'm studying for my lifestyle medicine certification, there are 6 pillars of lifestyle medicine. Those include things like nutrition, physical activity, sleep, social connection, stress reduction, and then reduction in the use of harmful substances. And that's the one that I'm going to talk about today. So, we're going to talk about alcohol. I have had several patients that I've seen over the past few months that have expressed concerns over the amount of alcohol that they're drinking or expressed concerns about loved ones and their use of alcohol. And so I just wanted to kind of update everybody with sort of what's out there and what's new in the world of alcohol, alcohol use disorder, what identifies as risky behavior, and how can your physician partner with you to help you or your loved one with that. So, alcohol use is exceptionally common. It's probably, I think it is the most common drug, if you want to consider it a drug, in the United States. And a lot of that's because it's so widely accessible and it's such a embedded part of our socialization and our culture and our community. The use of alcohol has gone up during the pandemic times, and it's actually remained elevated. Although many of you who are active on social media are probably seeing lots of advertisements for mocktails and those sorts of things, because a lot of those things are out there, because I feel like the community is starting to get curious about maybe drinking less. So in terms of alcohol, there really is no safe level of consumption. You know, every bit of alcohol does slightly increase one's risks of lots of adverse health effects, but those risks really go up once we get above 7 drinks per week for women and 14 drinks per week for men. um, the risks associated with alcohol use, of course, everyone knows about liver damage, so alcoholic liver disease, or alcohol-related liver disease, and the development of cirrhosis, which can lead to hepatic cancers, liver cancers. But there are lots of other ones that you may not be aware of. Alcohol use actually increases the risk of multiple cancers. Breast cancer in women is an extremely tight association, so risk of breast cancer goes up with alcohol use, as well as head and neck cancers, which are pretty gnarly cancers. So esophageal cancer, throat cancer, laryngeal cancer, tongue cancer, mouth cancer, which are really difficult and really challenging to treat and very disfiguring, as well as pancreatic cancer. There's also an elevated risk of cognitive impairment and progression to dementia. And I think this is one that we probably don't talk about enough, but alcohol use does increase your risk of cognitive impairment, brain aging, and dementia. It also has heart effects. So folks who drink alcohol have an increased risk of the development of atrial fibrillation, which is an abnormality in the electrical circuitry of your heart, leading to really fast heart rates in many cases and requirements to be on medications for that. Can also lead to heart failure in some situations. And of course, we know about the dangers with cirrhosis and alcohol, liver disease, and pancreatitis, and so on and so forth. So it is a drug. It is a toxin. It's actually considered to be a neurotoxin, but it's one that's very widely used and acceptable and in our society. So I just wanted to have a conversation about it. A quick way to assess, if you're a healthcare provider or a loved one who's interested, a quick way to assess for yourself or for others for potential risky drinking is to ask, how many times in the past year have you had over 4 drinks in one day for women or over 5 drinks in one day for men? If the answer is anything above 0, that could indicate that there may be some risky drinking going on. Now, sometimes it's I had my 40th birthday party and we went out and there was a weekend of heavy drinking, and that's not the typical. So you kind of have to suss it out to see how much, but that is a pretty good indicator of if someone potentially has risky alcohol behaviors that would warrant further investigation. So what does that further investigation look like? Well, your healthcare provider is probably going to ask you some questions about the 4 C's. If you have not heard of the 4 C's before, they apply to any type of addiction. And I'm not saying that everybody who has these things has an addiction, but we're going to talk about what those 4 components are and the questioning that will go along with it so that we can determine how to best help you. The first one is compulsion. It's compulsion, craving, consequences, and control. So compulsion is just this desire, this need to have it, and to, when you don't have it, whether it's any sort of addiction, it could be alcohol addiction, sex addiction, some sort of drug addiction, Netflix addiction, maybe. But when you don't have it, you're irritable, you're anxious, you're moody, Those can be some of your signs of compulsion. The craving piece can be described almost like a hunger pain. You just can't really stop thinking about it. You kind of can't wait to get home and to have this or do this or get to the party and have a drink or have a smoke or whatever it is. The next one is consequences. And I think this one, when I was in medical school, the examples were always it's trouble, it's causing trouble at work, or it's, you lost your job, you got a DUI. And those are, I think, clearly those are consequences of problematic alcohol use in patients. But I think that the consequences can actually be more subtle than that. So it can be impaired relationships with your children, or with your family, or with your spouse, or avoiding certain social situations, or avoiding activities in the evening where you wouldn't be able to partake in alcohol, or things of that nature. Those are also consequences, because when we're thinking about the holistic approach to one's health, it includes the social connection and includes stress relievers and doing social things with other people. So the consequences are pretty individual. And so what you could ask or think about for yourself, if you're wondering about this for yourself, is, are there changes in my behavior on a daily or weekly basis that I'm making because of this desire or this need or this, this want to partake in alcohol or tobacco or whatever the concerning substance or pattern of behavior is. So, what do we do about it? So, fortunately, in the past few years, there have been lots of um, new treatments and resources available for people who would like to consider reducing or eliminating their alcohol usage. And I say that because I think the old adage was that you had to become completely sober. Now, for patients that have clear alcoholism, sobriety is almost certainly going to be the way to go, because some of those patients are drinking alcohol at such a dangerous level that they're not going to be able to reduce. They're all in or they're all out. They're go big or go home. But for most people with sort of a mild alcohol use disorder, and I think there's a fair amount of the population that falls into this category, you can actually cut back substantially by being more mindful of your alcohol use. For many people, it's just a change in the pattern and the habitual nature of drinking in the evening or drinking on the weekend or drinking however they are. There are lots of great apps out there. One that I've been told about is called Sunnyside, that can actually, there's a community around it, and you can put in how many drinks per week you're planning to do and then kind of keep track of it. And it's just sort of, there's the accountability piece, and you track your alcohol usage. There are lots of support groups out there to reduce alcohol use. And of course, there are the 12-step AA type programs available as well, especially if you're looking to become, or the person's looking to become completely sober. But there are lots of options. So there are several medications that are being used for alcohol use disorder now. One of the most common ones now is naltrexone, which people think about as used for opioid use disorder, but it also has some positive beneficial impacts for patients that have alcohol use disorder as well. There's another medication called acamprosate, and also disulfiram or antabuse. That one's my least favorite. That's the one that if you drink while taking it, it makes you feel just absolutely horrid, versus the other two that kind of just reduce your interest and need and desire to have it. And so they're good for people that want to reduce those cravings or that tendency to reach for alcohol or potentially another substance, and choose something different. There are some other off-label medications like baclofen, Topamax, or topiramate, gabapentin that can be helpful. So be sure to discuss these with your doctor. It's not going to be a judgment situation. We really just want to help you be healthier and make better choices and help you have that long, productive life. The other interesting thing is that these new GLP-1s, like semaglutide and tirzepatide and all these different types of agents, may also have some benefits. They're not yet FDA approved for this purpose, but there are some early indicators that they may also help because of how they're able to recircuit and rewire the dopamine pathways in your brain and the reward system. So more to come on that. I think we probably will see some of that in the future, but lots on the horizon, lots of options. If you drink heavily or if you use other substances heavily, you're not a bad person. You're just someone who may want to think about making a healthier choice to reduce the risk of long-term health consequences and ensure that you have strong relationships with your family, your friends, and are choosing health optimization. If I can be of any help in the Indiana area, please let me know if I can help. Laurel Fick. I am at Niche Medical and Consulting in Carmel, Indiana. Take care. Bye.